Thank you, dear students, for joining us. Today we will be presenting the first lecture in problem-based learning. In this lecture, we will be presenting 9 cases. We will be presenting the patient's characteristics, the patient presentation when it comes to symptoms, the findings, physical exam, some laboratory findings, and by the end of this course, there will be another lecture which would present the diagnosis and the explanation of the patient's findings. So we will start by presenting this case. This is case number 1 for today, and it's about a 19-year-old male college student who is presented with some history of yellowish discoloration of the sclera and some exertional fatigue and shortness of breath upon exertion. So these symptoms, we're having symptoms that would suggest anemia, I mean exertional fatigue and shortness of breath. This can be caused by anemia, and then we have this discoloration of the sclera, which would probably mean jaundice. So we have probably jaundice and anemia. This is what we should think of. Additionally, the patient has left-sided abdominal pain and some family members with the same or similar symptoms. So this condition could be inherited. The findings upon physical exam are paler, so he is pale, so this would confirm what we thought of about anemia. And then he's also jaundiced, so he has the yellowish discoloration of the sclera and the skin. Also, he has splenomegaly, which would explain why he had the left upper abdominal pain. And also, we have some abnormal red cells on the blood film. So these are the findings. As you can see, there is some yellowish discoloration of the sclera. There is a splenomegaly. This is the spleen size marked after being examined, and these are the abnormally circular rounded red blood cells found on the blood film. So what the condition that this patient may have is something that we need to think of, and we will find out in the second lecture that we will present, as I said, by the end of this course. Keep in mind there are some family members with similar presentation or similar conditions, so this condition is likely to be inherited, in which the patient is having anemia and jaundice. Okay, so case number 2, we will be presenting this case about a 24-year-old male who is presented with a new onset yellowish discoloration of the sclera with exertional fatigue and shortness. So the presentation here is again similar when it comes to having anemia symptoms and jaundice. And if we encounter a patient with such symptoms, the thing that we should think of is mainly hemolysis. So the patient in case number 1 and this patient in case number 2 would probably have some kind of hemolysis. The urine is very dark, and the patient was normal before attack, so completely normal before having the attack. So the attack is of sudden onset or of a condition that was in remission or not causing issues before. He had fevabine ingested 1 day before the onset of symptoms. So this is an important relative mentioned here that we should keep in mind, that he had some fevabine. On physical examination, he was found to be pale and jaundiced again, which would confirm the anemia and jaundice, the hemolysis. And then we had another sort of abnormal red cells on the blood film, as you can see here. These are some incompletely rounded red cells. I mean, there are some defects here on the membrane, so they are not completely round. There is some kind of bite, or as if they have been bitten. Some bite red cells. That's what we call them. Okay. So this is case number 2, another type of hemolysis that would probably also would have some other family members included. It could be inherited, but it is characterized by and paroxysmal presentation of hemolysis or of attacks, and also with some ingestion of fava beans, and with some abnormally red cells in another form. The first case we saw the completely rounded red cells. We now have the bite, what we call the bite cells on the blood. Okay, so move on to case number 3, which is about a 20-year-old female college student who is presented with acute pain in the back, shoulder, and extremities. So she reports that this is not the first time, so she's had such attacks before. Attacks are more frequent in cold weather and stressful conditions. Okay, so there are some precipitating factors to such attacks. On a previous occasion, she was admitted with respiratory symptoms and had her blood exchanged. Okay, so she's had some more severe forms of these attacks, which required her to be admitted and her blood to be exchanged, leading to some skeletal abnormalities and leading to repeated attacks of pain in the back and shoulders. Move on 3 pregnancies within a short period of time, and also she's losing blood with her menstruation every month. We could easily think or predict what's the condition given the findings that we have presented now. Blood loss through the GI tract associated with some weight loss and altered bowel habits. So what would you think you should do for this patient? So confirm the diagnosis first, and then how would you look for the cause of his condition? Being not compliant with the medications she's been prescribed, so she's at increased risk probably for having a form of certain anemias that would cause jaundice also, and some, more importantly, some paresthesia, numbness, and shuffling gait, meaning some neurological symptoms. So the anemic is having an abnormally functioning white blood cells and an abnormally probably low platelet count. Okay. So when we examined her, we find out that she is pale. She has documented fever, so she is febrile. She has ecchymosis, petechial rash. There are also some abnormal red cells or abnormal cells in the blood film and in the bone marrow. The bone marrow examination reveals a hypercellular marrow and replaced by abnormal cells. So some pictures here of the findings. So these are the ecchymosis or the bruise on the arm, and this is petechial rash. And when you see such kind of bleeding, ecchymosis, bruises, petechial rash, purpura, you would think of platelet dysfunction or platelet quantitative disorder, either low platelet or dysfunctional platelet, a primary hemostatic defect. And these are the abnormal cells in the bone marrow. So the bone marrow or the blood film would show some abnormally shaped or abnormal cells that shouldn't usually be there. And this condition would result from the bone marrow being unable to produce healthy cells as it should, because the bone marrow is mainly being replaced by abnormal cells. Abnormal cells would replace the bone marrow, would take the resources of the bone marrow to produce healthy cells. And these cells can be hematological, such in this case, or can be non-hematological, infiltrating from outside. In this condition, these are hematological cells, but abnormal cells that are replacing the bone marrow. Moving on to case number 8. Case number 8 is about a 40-year-old gentleman presents with acute onset of symptoms that started 1 week ago. So the symptoms are fatigue, palpitations, and shortness of breath again. So anemia symptoms, fever, gum bleeding, and skin bruising. So overall, these symptoms again suggest that the bone marrow is in failure, bone marrow failure, or having problems producing healthy red cells, white blood cells, and platelets. Mm? There are no previous episodes to such condition, and there are no family history of similar conditions or symptoms. The findings: so this patient has a paler, documented fever, a skin bleed, ecchymosis, petechial rash again, blood film showing here. It does not show the abnormal cells that we have demonstrated in case number 7, but it is showing reduced cell numbers, but no abnormal cells. So there are no abnormal cells replacing the bone marrow, but the bone marrow is markedly hypocellular. So there is hypo or significant marked hypocellularity of the bone marrow. In both conditions, case number 7, case number 8, we are talking about bone marrow failure, but the case number 7 is secondary to the bone being replaced by abnormal cells. Case number 8 is about a bone marrow that is not producing cells because it is hypocellular. There aren't enough cells in the bone marrow or precursor cells to produce the mature cells. So this is bone marrow failure due to a condition that we will find out about in the second lecture. Okay, moving on to case number 9, our last case for today. It's about a boy who's 7 years of age, presented with a swollen knee of few days duration. This is not the first time it happens, so he had similar episodes of this before. Both knees and ankles are affected, but his right knee is affected most. So there is a joint that is affected most of the time and is affected more than other joints, which are the knees and ankles mainly. Symptoms start by feeling of hotness in the joint. So the first symptoms that he would experience is feeling of hotness in the joint, and this is followed by swelling, pain, reduced ability to move, and hot skin. And his mother reports he bled abnormally after circumcision, so he had another form of bleeding other than bleeding inside the joint, which we called hemarthrosis. So he had bleeding after circumcision, in addition to the repeated episodes of hemarthrosis that we have just described. He has not had any surgical procedures done. Okay, so we don't know if he would bleed after surgeries. His mother thinks that some of her family members had similar symptoms, so he has some maternal relatives who would probably have same condition. Upon examination, his right knee, as you can see, is swollen. A swollen knee with effusion that is likely secondary to the presence of blood inside the joint. It's also hot, and there is significant reduced of movement or range of motion. So this condition is found in a young male who has some family members from his maternal side who have a similar presentation. He has repeated attacks of hemarthrosis, bleeding inside the joints, but there is a joint that is bleeding more often, and the joint, as you can see, is swollen with reduced range of motion and is hot, indicating the presence of acute bleed inside it. So what would be the diagnosis, you think? I hope you have enjoyed the presentation of this lecture. I will going to see you again by the end of this course, inshallah, to discuss the diagnosis and explanation of these patients' findings. Thank you.